Well, talking about lower back pain or low back pain, well, it's something that is caused by many different diseases or conditions or even injuries. And a lot of persons will have to go through it one time in their lifetime, while there are those who will have it with them always. Well, today I have right here with me the Director of Nursing Service, National Orthopedic Hospital, Igbobi, Lagos. She is DNS Razak Oyetola. She's right here with me and she will help us understand or even know more about low back pain. Good to have you join us today, ma'am.
Thank you very much, Patricia.
All right. I'm actually happy that we finally are able to do this. We're finally able to do this. Okay, talking about low back pain, talk to us about it. What does it mean?
Low back pain is defined as painful condition affecting the lower portion of the spine at the level of L1 to L5. It is a musculoskeletal disorder affecting the general population. Low back pain can affect job performance. It can also affect social responsibilities. It can start gradually as we age or suddenly following an injury. Low back pain can range in intensity from a dull pain to a shooting or sharp pain.
All right. Well, very quickly, can we talk about the causes?
Yes, thank you. Causes of low back pain include any structural problem of the back, of the vertebra column, the spine. I said it affects the lower portion of the spine at the level of L1 to L5.
That's from where? Here?
Yes, here.
Okay.
The spine starts from the neck, and it consists of the 3 bones, vertebrae. At the neck, we have 7 cervical. Then we have the next, we have 12 thoracic. Next is there are the 5 lumbar vertebrae. We have the 5 fused sacrum and 4 fused coccyx. The lumbar vertebrae are the largest portion of the spine, and they bear the weight of the body, upper part of the body. Within the spine, the lumbar vertebrae, or the spine, we have the intervertebral disc, which is cartilaginous in nature, and if there is, with continuous usage of our back, some of them tend to develop problems. So any problem, any structural problem of the spinal part of the body will result in low back pain. And this can be in form of congenital malformation from birth. We can have people that are born with congenital abnormality like scoliosis, which is lateral curvature of the spine itself. There may be exaggeration of the thoracic part of the spine, which we call kyphosis, Ike in Yoruba. There may be lordosis, which is inward curvature of the spine. At times, there is incomplete closure of this spine, which we call spinal bifida. All this will result in low back pain. Apart from the congenital causes, we can also have injuries that will affect the structure of the spine. Injuries that can arise from road traffic accidents, falls, sports injuries. We can have sprain, we can have strain, we can have fracture of any of these bones. We can have compression in that aspect, which will cause pain as well. Also, as we age, majority of the things we do, we use our back. As we age, the disc in between these bones may be degenerated, go through degeneration, and this will also result in low back pain.
Is there anything we do that will hasten the degeneration?
Yes.
Okay.
There are so many things that we do that can lead to degeneration. In carrying out our job activities, our social responsibilities, we use our back most of the time. Bad posture is one of the things most people don't even think about.
I think we need to learn that, how to sit up and
yes,
how to walk and all that.
exactly.
Okay.
Occupational activities too that we do for a living. Some are engaged in lifting heavy items. And all this can have effect on the back, at the back, resulting in pain. Some of us, when we work, these days we work on a computer. When we sit, we don't sit upright. We tend to snap forward. And all this is causing a lot of damage to our back. When we go about the daily listing, majority of us carry heavy bags.
Present, ma.
Heavy bag. Even the school-age children are not left out in this, because the backpack they take to school are heavy, and they tend to overuse that bag as they grow. Don't forget that today's children will become tomorrow's adults. So as long as we continue to overuse the bag, it tends to degenerate early.
All right. Well, very quickly, let's talk about the symptoms now. What are the things that show or that tell a person that, well, what you have is low back pain?
The symptoms include pain at that place that I've already described between L1 to L5. There will be certainly pain, a lot of discomfort. The person involved may not be able to stand upright.
When you say the person may not be able to stand upright, is that a complication or is just the beginning stage?
It's discomfort. Because when you are having pain, you can experience pain. You can in so many ways.
Different degrees.
Yes. I said earlier that it can come, the intensity can be from dull to using sharp or shooting pain earlier. It depends on the degree and the type of pain. There may be difficulty in walking. Even in sitting position, the person may not be able to sit properly. Then the person may experience difficulty in changing position from standing to sitting, from sitting to standing. There may be tightness of the muscles around that place. There may be spasm of the muscles. It may even radiate to the legs, causing some tingling sensation, whatever. So it depends on the type and the level.
All right, let's talk about the risk factors now. What are the things that could predispose a person to coming down with low back pain? You already mentioned some things while you were talking about causes, and I think some of them can pass as risk factors.
Yes. Age, like I said, is not on our side. So as we age, aging process, all the parts of the body also age. So we tend to have degeneration as we age. Apart from that, our weight. I described that this part of the body, the L1 to L5, carries the load, the weight of the upper part of the body. So in people that are overweight or obese, obesity can be a predisposing factor to low back pain. Occupational activities, like I've said, some are involved in jobs that they need to sit down for so long, sitting for too long, standing for too long. All this can cause, it can be risk factors to low back pain. Sedentary lifestyle.
Yes.
People that are so blessed that they have so many people to run around for them, so they don't even bother to do anything. Lack of exercise may be a factor, a risk factor to low back pain. Smoking itself, because it contains nicotine.
Smoking, I really do not know why people still smoke, because for every ailment you mentioned, somehow smoking is a factor.
Yes, but for low back pain, smoking, when the cigarette you smoke contains nicotine that aids the degeneration of the intervertebral disc.
All right, I see you talked about smoking, and you've also talked about some other things that can actually stand as risk factors. Now let's look at the treatment. How is it being treated? And then I like that you talked about the intensity, that for some persons it will be very serious, for some other persons it may not be as serious. So for those people who are not feeling it as seriously as some other people, do they have to bother to go to the hospital? Can they just walk into a pharmacy, get something over the counter, and they'll just be fine?
Thank you very much. It depends on the type. The treatment depends on the type. Like I said, we have acute, we have chronic. The acute one can actually be managed at home because the acute one lasts just within 3 weeks and it goes. But the acute one, if not properly managed, can develop into chronic. And chronic ones are those that last from 3 weeks to over 3 months or whatever. Notwithstanding, whenever one develops pain, the best thing is to come to the hospital. Because the acute pain that I said can be managed at home depends on the cause. The cause of the pain, because when you come to the hospital, we need to start from history taking.
Yes.
What actually caused the pain? How did the pain start? What aggravates the pain? What relieves the pain? We need to know all those factors before we can know the treatment. For home management, as advised by healthcare professional, some may be relieved with just application of hot compress or ice pad as advised by healthcare professional. Warm bath may help to relieve, but like I said, it depends on the cause and the type of the chronic pain, or the pain. But the chronic ones, we definitely need multidisciplinary approach. So medication may be necessary to relieve the pain, the muscle, relax the muscles. Physical therapy may be necessary.
For physical therapy, at what point will somebody need physical therapy?
That's what I said. It depends. When the person comes to the hospital and the history is taken and the exact cause of that pain is known, because it may be due to so many factors.
Yes.
So it is when the cause is known and the right diagnosis is made that you can know the exact treatment. Physical therapy may be necessary. Medical appliances may be prescribed too to support. In some chronic cases, they may need surgical intervention.
I understand that, but I would like to know, how do we get to that point where surgery is needed? What does it look like? Or what, let's say, for anyone who needs surgery, what are the likely things the person is going through?
It will definitely be a very chronic pain. And before it can get to that point, having come to the hospital and proper history has been taken, assessment will be done. So many investigations will be carried out, like going through X-ray, going through CT scan, MRI, nerve conductive test may be done to know whether it's the nerve that are affected. Blood studies may be necessary to know whether there are underlying infections. So they don't just ask patients to come for surgery. We need to diagnose the exact cause of the pain before you know the right line of treatment.
And I guess this is why it's important that people do not just treat themselves at home or go to a brother's friend or an uncle, sister's brother and all of that. We need to come to the hospital. Thank you so much. We've had a great time listening to you talk about low back pain, and I'm really impressed really by some of the things you've talked about. But very quickly, can we talk about prevention?
Thank you. Prevention, they say, is better than cure.
Every time.
Yes. Most of the time, like I said, we use our back to do every activity. So we need to engage in regular exercise in order to strengthen the bone, and the muscles around that place. We need, those of us that are overweight, we need to shed our weight so that we won't be carrying much weight. We should avoid lifting heavy objects. And if we must lift heavy objects at all, we must lift it rightly. We should lift with our legs and not with our back.
Okay. How do you do that?
You squat and then lift while you straighten your back to lift to yourself. We should take diets that are rich in calcium, and vitamin D.
Examples? Examples of calcium and vitamin D rich food.
Yes, like milk, green leafy vegetables, fish, eggs, yogurt, and beans. And they are part of those ones. We should learn to sit properly.
I hope I'm sitting properly
You are
now.
not resting your back.
My DOP will tell me not to rest my back. That's it. If he gives me the go ahead, I'll rest my back.
Okay. So we should learn to sit comfortably wherever we are. When we are carrying out our official duty and we are at home, because it will help us to preserve our back. Those of us that smoke should stop smoking. We shouldn't even engage in wearing high heel shoes. You are smiling? Yes. So those are some of the things that we can use to prevent low back pain. And if peradventure we come up with low back pain, we should not stay at home. We should report at the hospital.
Okay, that's a good one. Thank you so much, ma'am. Before we wrap up this conversation, I do not know if there is anything you'd like to share with our teaming audience.
Thank you very much. Low back pain, like I said, is very common. But as common as it is, majority of the causes are preventable. I will advise the audience to strictly adhere to preventive measures. And as we carry out our duties, let's remember that our back is very, very important to us. We should mind, parents should try as much as they can to know, to look into the back pass of the school children, because children can also have back pain, so that they won't be developing back pain early. And if peradventure we have back pain that we can't even do some of the activities we do, we should not stay at home. We should come to NOHI. National Orthopedic Hospital Igbobi is a specialist hospital that deals with all this type of. We have so many experts here that can treat the patients. Staying at home is not going to help us, because from the study we have found out that 20% of acute pain develop into chronic. The earlier, the better. It's better for them to report early at National Orthopedic Hospital.
All right, thank you so much, ma'am, for sharing all these with us. Thank you so much.
It's my pleasure.
All right. Well, I guess you had a great time listening to DNS Razak Oyetola. I personally had a great time listening to her, and I hope my DOP will allow me rest my back. Do have a wonderful time. I am Perpetua Fasami Peter. Bye for now.